What's on your mind, ma'am? And thank you for calling and listening and stuff like that.
Thank you. Uh, I've been taking Vesicare for a really long time, and I'm trying to get off prescription drugs. Can you help me with this?
Very likely. All right. Anything named Vesicare has got to be for the bladder, doesn't it?
Right, overactive bladder.
Overactive bladder. Oh my goodness, ma'am.
Yeah,
How long's that been going on?
years.
Um, since before menopause?
Yes. Mhm.
Okay. You wouldn't have happened to have been a bedwetter when you were a kid, would you know?
I don't know. I don't know. Couldn't tell you.
Wouldn't hurt to ask your mom if she's still with us, simply because it's if a person's got an overactive bladder when they're an adult and they were a bedwetter when they were a kid, that one's easy. All we
Uh
have to
huh.
do is find out what foods the person is allergic to, whether it's a small child or a larger adult. Well, let's say medium-sized adult, um, and remove those foods, and oh my goodness, the bedwetting goes away in the very, very large majority of cases. I wish I could say 100%. It's close, but it's over 90. Food
Uh huh.
allergy, because what food allergy does to both infants and adults. I worked with a guy who had overactive bladder. He's 65. He was a bedwetter when he was a kid. His mom told him about it enough, so he told me that. So we did an allergy test. He went off the allergic foods, and it took a couple, 3 weeks, and the bladder stopped spasming. Now, allergies
Mm.
cause spasms. For example, if we're asthmatic and we breathe in something we're allergic to, the lungs go spaz and we wheeze. Well, funny thing, but gallbladder attacks are nothing more than spasms in the gallbladder. And if people quit eating the foods they're allergic to, they never have another gallbladder attack. And there is 100% research on that by the chair of the Food Allergy Committee, the American College of Allergists, Dr. James Brenneman, who also is the one who told us that we could get rid of nearly all bedwetting by just stop eating what you're allergic to. Now, what
Oh.
happens? What happens is a chronic spasm if we're continuing to eat things. And some pediatrician, again working with bedwetting kids, measured the volume of fluid that the bladders of bedwetting kids could hold and the bladders of non-bedwetting kids. And the bedwetting kids were down to about half the volume. And so you might think, oh, they just got small bladders. Uh-uh. Then they took them off all the allergies. The bladder quit spasming, and the volume it could hold went right back up to normal, just like the normal kids.
Mm.
So anyway,
Mhm.
I'm
And
not
if
saying,
it's not a food allergy?
okay, if it's not a food allergy, then the next thing we look at is magnesium, ma'am, because magnesium makes muscles relax. So one does a food allergy test because look at it, if it's making the bladder react, it's also bothering you all around the rest of the body. It's fighting with your immune system, which doesn't like allergies, so it puts out like a lot more white blood cells to fight it. And we want to get rid of anything that the immune system has to fight back against if we can. And of course, we can't get rid of everything in the world that our immune systems have to fight back against, but we can get rid of foods. So I always ask people, please check that first because that's so simple. It might be difficult in other ways psychologically. I really like eating that stuff, and you mean to tell me it's making my bladder spasm? I don't want to stop eating it. Yeah, I know. But
Mhm. Well,
if it's
I
not
I
that,
take
then
a lot of magnesium.
but taking it doesn't work near as well as getting that magnesium oil, it's called. All the natural food stores, compounding pharmacies, Tahoma Dispensary has it. And you take that and you rub it right over the top of the pubic bone where the bladder is under that because it gets the magnesium right into the organ that's spazzing.
Hmm.
And
I
that's
see.
rub, yeah. So I usually will say, hey, please, um, get the food allergy checked first because you want that out of your system. And then if it's not that, then try the magnesium. Use about a quarter teaspoon rubbed into that spot. Okay,
Okay.
ma'am.
Thank
So
you.
you're welcome, and I hope some of that does something for you, ma'am.